Good morning, everybody. It's Dr. Verma here. I'd like to start off by saying good morning, NOSM. Thank you all for joining us. There are over 245 of you on this call. And so our IT office has muted all of your microphones. That's to be sure that we don't have a tremendous amount of feedback and echoing on the line. That's not to censor you or mute you in any other way. But welcome, good morning, Dr. Sarita Verma, President, Dean, and CEO of the Northern Ontario School of Medicine. I want to spend the next 10 to 15 minutes having the opportunity to ensure that you are aware that our senior leadership team at NOSM and myself are on the case. We are keeping track of what's happening with this rapidly evolving situation with COVID-19, and we want you to know that we're aware of all of your issues, and if not, you will make us aware of them as of today, and that we will be working diligently to support you in every way that we can. I'm speaking to you from my home office. Behind me, you can see my I Love Me wall, which has all of my great certificates on it. That's because I'm here in self-isolation. I did travel internationally and returned a week ago. But also, just as an example of how you have to be diligent, I have underlying lung disease, autoimmune disease on immunosuppressants. And I also am over the age of 60. I know that comes as a surprise to many of you, but I'm 62 and therefore in a high risk category. And as a result, I'm self-isolating not only for myself, but also because I have tremendous contact with hundreds of people. And so it's important that self-isolation not only be seen as a self-protection, but also as due diligence to protect the public and our colleagues. And I open with that because I think it's really important first to say, everybody take care of yourselves. This is an extraordinary time. This is a difficult time, and it creates a lot of anxiety. And my goal is to assure you that, again, we're aware of what's happening and we're going to do our best to take care of you. I also want to open with a tremendous amount of admiration and respect for the leadership that I've seen from NOSM, from our students, our staff, our faculty, everybody involved in NOSM, including the people who you don't see, the cleaners, the facilities maintenance people, the people who keep our buildings stocked with Purell, the staff and the administrative assistants who are making sure to get. I could name quite a lot of people, ranging from Jay, Kyle, Lyndon, and Justina, who have contacted me on behalf of students. Excuse me, Brian and Peter, Lee, Jeff, John in undergrad medical education, Jennifer, Paul, Rob, Christy in postgrad, and in health sciences, Jennifer, Denise. Many of you have shown tremendous leadership, certainly in IT, as I said, Steve, and on this line, Joseph. And of course, in our staff, Ray and Lynn, and all of our people who are coming to make sure that payroll gets out. Bravo and brava. You're doing a fantastic job, and that extraordinary leadership is what makes us terrific and fantastic as an organization. You're showing positive roles, and you are living and breathing our socially accountable mandate. So thank you very much. Truly, there are great stories coming out. As you know, our students have offered to support medical professionals and the elderly in the community because they're able to actually redeploy themselves from their in-person courses to supporting the community. That's awesome. It's really unbelievable leadership and community engagement. And so, you know, one thing that's constant during all this time is our humanity. And I have to tell you, tremendous admiration and respect for all of you for actually stepping up and showing this. I see from around the country and of course, south of the border, so much anxiety and so much worry. And I have to say that you're coping extremely well. Let me assure you that NOSM is in great shape. Academically, we have a handle on all of the aspects of our program, and we have a handle on what's going to happen as a result of the academic disruption, as well as we're working very diligently with national organizations to look at the continuity that's needed as a result of the end of the school years, as well as the certification of our residents and our students. Rest assured, there are solutions. We can't officially announce any of them right now. And most of your questions start with the three words, when will we? Well, when will we know? When will we have the answers? When will we receive? And you will receive it as soon as we get that information. We're working very much on ensuring that there's academic continuity for undergraduate medical education and for all our health sciences programs, so that, as you know, all our in-person classes have been canceled and everything has moved, if possible, to online. Specifically, questions for undergraduate medical education with regards to receiving online scheduling and making up for assessments, making up for exams, accommodations, and what's going to happen with 106. Those decisions are being made this week and they will be transmitted to you. With regards to clinical clerkship and those who are going into phase 2 or phase 3, those who are anticipating looking to having OSCEs and exams, they will be rescheduled. And you'll have to make some tough decisions with regards to where you're going to be, whether you keep your leases, etc. A lot of these are life decisions, but my best advice to you is we're making decisions based on the 2-week aliquots because we can't really plan too far ahead. The anticipation is that given the vector of this disease, we may be able to make some final decisions by the end of this month. But a lot depends upon the containment of this disease. And therefore, for our learners, for our staff, and our faculty, you're going to have to stay tuned to CBC, CNN, Public Health Agency of Canada, Public Health Agency of Ontario, and your local public health, because you're getting the news as we're getting the news. And so we won't be able to answer you. You probably may even know sooner than we do, but we're hoping we're keeping our fingers on the pulse. This is really not, as I said, talking about myself, about spreading the disease or getting sick as much as it is containing the spread of the disease. And that may seem to be a nuance, but I'm not an expert. I'm not an epidemiologist. And in fact, you know, we're just trying to make sense out of all of the deluge of information we're getting at the same time. But the truth is that this has a self-limiting course, and the length of the course of the disease depends very much upon the containment of the disease. And so as you see, my great hero, Theresa Tam, Bonnie Henry from BC, Anthony Fauci on CNN, saying the same thing. Let's make sure that this doesn't become exponentially as big of a problem as it was in Italy, Iran, and China, and Spain. You look at dense areas like Hong Kong and Singapore, they've managed to contain the spread of disease, but they also have fairly draconian societies. But some of our containment is aimed at you, because you, particularly the health professionals or the emerging health professionals, you deal with vulnerable populations. And in particular, we're very conscious that our rural, remote, and First Nations communities need to be protected. So that's the basis for a lot of our decisions. I want to thank everybody who has been working at these Herculean levels to continue to be communicative and to make sure that they are continuing to keep you up to date. The main source of information for you should be our website. Go and check it right now. We have up-to-date information for undergrad, postgrad, health sciences learners, for staff, for faculty. We have links to Laurentian, Lakehead, HSN, TBRHSC, and to the public health resources that you need. We have information about electives, as best as we can manage them because of the national shutdown on electives. We have information about the impact on conferences and meetings. As you know, most conferences have either been canceled or they are going to an alternate plan. To our learners, I know you're worried. I know you're anxious, and I know you're worried, and we all appreciate that. We want you to know that your well-being is the most important thing to us. And as soon as we have information, we will let you know. Everything we're doing is based on the science that we know. It's a great opportunity for you in undergrad and postgrad medicine, but also all health professional programs to spend a bit of time taking a break, having a breath. You have very intense programs, and many of you have told me that, in fact, it's hard to keep up. So this is an opportunity to go back, review that neuroanatomy, look at the Krebs cycle, learn a little bit that you've had difficulty learning, tutor each other, help each other. But also it's a good opportunity to look at epidemiology and understand public health. This is an area that's not going to go away. Use the opportunity to reflect on the spread of infectious disease. I want you to know that we are working nationally with our AFMC, the MCC, the Royal College, CFPC, etc. It's an alphabet soup, folks. But basically, we want to be sure that we're consistent and fair, and everybody in the country is in the same boat. So we know, learners, you're worried, our students, our residents, and most importantly, you need to take care of yourselves. We have specific instructions for you if you're high risk. You're not expected to be in clinical activity, but if you're not able to be in clinical activity, use the time wisely. As I said, take a breath, take a break, but also take the opportunity to review things that you feel uncomfortable about and learn them better. We're going to do everything we can to ensure that your academic continuity is protected. To our staff and faculty, I know you're worried too. I know that you have kids at home. It can be challenging, especially if you don't have daycare. I know that many of you are worried about your financial stability. I know that we're all watching our RRSPs tank on the markets. Our investments are going south. It's just a very disruptive time for all of us. And we are aware that, we need to be flexible and accommodating with you. So very important, if you feel that you need to work from home, and indeed, if the government makes announcements today that require certain segments to work from home, please do. We will do everything we can to support you. And we're doing everything we can to ensure that there's a minimal impact on you. Importantly for you to know, financially, NOSM is in great shape. We're solid. Payroll will continue. Operationally, we're solid. Academically, we're solid. We're going to be able to get through this with really minimal disruption. I'm aware of many other medical schools where that's not the case. And I'm proud to say that I have a crackerjack team. They're working all the time, and they're going to make sure that you're well protected. For those of you who've had to cancel vacation and had to get refunds for your cruises, these are difficult situations and difficult decisions. But you know what? We'll work it out later. We'll see what we can do to make sure that you get some time off. No guarantees, but definitely so you know it's top of mind. So none of us are experts in the diagnosis and treatment of COVID-19. I highly recommend that if you have questions, you check with your primary care provider, but realize they're pretty busy. So if you actually check a website or check with the public health website, and if you're worried, of course, that you have the disease or you've got infected or exposed, go to the local testing site. There's plenty of information on your local public health site. But the bottom line is I get a lot of questions about the disease itself or the virus. I'm not an expert and I won't be able to answer them accurately. I don't want to be like the president of the United States and say all kinds of things that aren't true. So we want to be sure that you get the appropriate information. It's quite clear to us that the most important thing is to continue to help each other and to really be compassionate and kind with each other. So I want to say again, I'm incredibly proud of our students who've stepped up, our staff, many of whom have worked all weekend and continue to work 24/7, and of course our faculty who are now many doing double duty, caring for patients, being on the front line, but also making sure that the education programs continue online. This is a reflection of how amazing our community is. Now, I know it's going to be really frustrating because you all have a gazillion questions. And I think the best thing to do is to direct you to the emails, communications@nosm.ca, communications@nosm.ca. Check the website, you'll get it there. Also, of course, many of you know that dean@nosm.ca has been answering many of your questions. That is not a private site, so if you have private questions, beware. That is shared by 4 other people to manage the volume. Now, I'm going to stop here. Thank everybody again, and I'm going to ask Dr. Brian Ross to make a few comments from the undergrad medicine perspective. And I'm going to ask Jennifer Fawcett to make a few comments from postgrad and health sciences. Then I'm going to ask Ray Hunt to speak for faculty and staff, any big issues that are coming up. And finally, Jay Mashru, if you're on the line, I would like you to make any comments from an undergrad medical student perspective. We're going to wrap up with Johnny Della Vedova, sorry, Johnny, with a few tips and advice on wellness and support. So, Dr. Ross, can you make some comments, please?
Good morning, Dr. Verma, and hello everyone on the call. This has certainly been a difficult time, but I'm very happy that everyone in UME has come together to try and see what we're going to do and get the program to continue. I got to say that the primary thing is for everyone to take care of their own health and the health of those around them. What we've been doing has been informed primarily by the need for personal safety and public safety, but also the principle of not delaying the educational programs, promotion and graduation. And just to say that, whatever we're doing at the moment, it won't go on forever. But the unknowns, of course, is how long. So there would always be a need for some flexibility. Things could change. The situation could resolve quicker than we expect, in which case we will have to make some, go back to more normal. But certainly we're trying to keep people updated as to what we're doing. A lot of the decisions have yet to be made, but we've been working pretty solidly to figure out what to do. So we keep on looking at the updates on the website, especially the information for learners and the MD students, which we've been posting on all weekend. Any major changes that I think of, we'll also send out group emails, but we're trying not to delve YouTube with too many emails. So just to summarize for everyone what's happening in UME, pre-clerkship, the phase 1 has temporarily gone to online only. That's been an interesting and creative venture for a lot of people in the program because we're not an online program. But we've moved a lot of things, and after March break, when it restarts, there'll be a lot of things that are just online or by telephone. And we'll publish some schedules for that as soon as we know. The exams have been moved. We can't have on-site exams, so we've moved them provisionally into the reassessment week, which we told everyone about ahead of time. So that's where they'll be. A lot of people are saying, what about the Indigenous health placement? A decision on that will be made in the next few days, so stay tuned. And overall, I mean, I think, as people are more at home and logging in to do things, as Dr. Verma said, it's a good time to review materials and to reflect on some of the things that maybe you haven't fully understood as your students. Phase 2 has, we decided to end the clerkship required clinical experiences on Friday, and the reason was a lot of our clinical sites were withdrawing from teaching, and for some level of fairness, we thought it was better just to do it that way. Of course, there's some things in the last couple of weeks of phase 2 that have not been completed, including assessment. And I'm meeting with Dr. Isfan today in the afternoon to decide what we're going to do with all of these. So there'll be a further update on that. Phase 3, the fourth year, continues. Clerks are still in the hospitals. We're going to, again, be very flexible. Whatever happens, we're not going to delay graduation for people. That's exactly how we're going to do that. It's dependent on how events unfold. But, if you're all going to graduate, don't worry about that. As Dr. Verma did say, if anyone's got is in the high risk categories, you don't have to attend, and we'll come up with some alternative activities for you to do at home. So overall, the program continues. So there's quite a few unknowns at the moment, but they will be less unknown as the week goes on, and we will keep you informed as to what we're doing. Thanks very much.
Thanks, Brian. Again, I remind people that the contact for phase one is Dr. Ross, but also John Friesen and Jeff Bouchu. General questions can still come in through the communications@nosm.ca. For phase two, contact Peter Istvan. And for phase three, contact Lee Toner. If you have questions, of course, as you know, many students, you can contact me and I will get the answers and get back to you. I'm unfortunately, the one who has to seek out many, many answers. And so I may not know the answers immediately, but we will do our best to get back to you. You may want to look this up, but there is an area that's called anticipatory anxiety. Anticipatory anxiety is anxiety about something that you know is going to happen, but hasn't happened yet. And so really important to be aware that, yes, we know, but you know what? The academic programs in undergraduate medicine are very fluid and flexible. And you will see that, there's a lot of things like you have to eat all your vegetables to get all your nutrition. But if you can take a multivitamin, to make do. So in a lot of ways, we're trying to adjust the program that we know is really, really good for you. But we can still meet all of our goals and objectives and get you through and carry on. Nationally, there's a lot of discussion about this for medicine in particular. But, we're all in the same boat. So I have to say, Dr. Ross is just awesome. His team is incredible. John Friesen, Jeff Batch, Peter Istvan, Lee Toner are doing their best to make sure you're taken care of. So hang in there. I'm going to turn over to Jennifer Fawcett for postgrad medicine and also a health sciences. Jennifer? Jennifer, you're on mute, so go off mute.
Good morning, Dr. Verma. Can you hear me now? Maybe I could ask Joseph Modi to unmute me.
We can hear you, Jennifer.
Okay, thank you. Good morning. I'm Jennifer Fawcett, the Senior Director of the Postgrad Medical Education Portfolio and Health Sciences. I'm speaking to you today on behalf of the postgrad dean, Dr. Robert Anderson, the residency program directors, many of whom I think have dialed into this call, and a number of our postgrad staff and management. The first thing I want to recognize is that with over 170 residents, each with a unique clinical schedule of their own, we are working as quickly as we possibly can to understand the clinical impacts to every schedule per person, and we will be with residents on impacts of either self-isolation or if somebody is unwell, or if there's a disruption in the clinical setting that they're in as others are deployed, and potentially residents themselves. We're very committed to the safety of our residents and to taking things on a contextual case-by-case basis, recognizing that our residents, of course, are both healthcare providers who, many of whom will work through this pandemic and are also learners and have unique needs as a group of learners at NOSM, and a very important group to us. The general update from postgrad is that we are working closely with our national colleagues around the uncertainty around the certification exams. I'm sure you all know that they've been postponed throughout CFPC, MCC, and the Royal College. For our residents who were due to sit exams, we don't know at this point in time when they will be rescheduled, and that's the same across the country for all residents in their final years who are facing that uncertainty. We are working together nationally and within program leadership for advocacy with, the regulatory bodies that will look at potentially provisional licensure. We don't have information, and once we have information, we will be sharing that with our residents. There have been a number of questions specifically around elective and core rotation travel. As of now, our key message is to minimize movement as much as possible and to be in touch with your programs. So for those of you who are on elective right now outside of Northern Ontario, provided that there hasn't been a direction of at-home university to leave your elective, we're encouraging you to stay in your elective. Be in touch with us if you have any needs to come home to your home base. We will certainly accommodate. For those of you who are in Northern Ontario elsewhere in rotation outside of your Northern Ontario home base, again, we're working on a case-by-case basis and are suggesting that you stay within your current rotation site. There has been a directive to return to home base when the rotation block changes. Know that there are differing lengths of rotations, so there will be clarification and communication from your program today as best we possibly can. In terms of communication, you'll hear from the postgrad office and you'll hear from your programs. Please at any time reach out to your program director or your program manager as probably the most key accessible individuals, and your program coordinators. When you're in doubt, please contact the postgrad office. We will continue to support. We are a very small school. We're a distributed school, but we're a small school. So the postgrad office and the program leadership, we're in close continuity all the time. So any questions that are fielded will be fielded amongst our entire team, and we're sharing information so that programs can be provided consistent information across. We are working on resident deployment principles. Many of you residents have asked, what does deployment mean? What would that look like? We're working through a series of principles. Again, we want to assure that you wouldn't be redeployed out of your scope and that there will be careful principles applied. If anyone is ever in doubt, your safety is our #1 concern, and residents have the right to refuse work. And please be in contact with a member of your program or the postgrad office immediately when you're unsure about a scope of work. The Wellness Office will speak to you, Jonathan Deladova, today, and we just want to again reiterate and reassure that the Wellness Office is open and available. And if anyone has any feelings of uncertainty, the Wellness Office will provide you with clarity around what to do in a work situation should you feel unsafe, in addition to the postgrad office. Academic continuity, all of our programs have moved their academic sessions as much as they possibly can in the short term to WebEx. There will be discussion underway this week around procedural-based options. And again, as has been outlined quite clearly earlier, all of us are committed to doing what we can to provide alternative work and options to not extend residencies at the current time while we work through the unknown. And we are working, as the entire school is, on a 2-week time frame. So there'll be much more information to follow over the coming weeks. And a general message of please reach out to your program director, your program coordinator, and the postgrad office, which is basically myself. I will be entirely available for any resident questions. Residents know my address, and it's also on the communication on the website.
Thank you, Jennifer. You know, people don't know this, but Jennifer is our postgrad secret weapon and a rock star. So she's really doing a terrific job, and I really appreciate it. We're going to turn to Ray Hunt for any updates on staff and faculty.
Thank you, Sarita. You can hear me okay?
Yep.
Great. My name is Ray Hunt. I'm the Chief Operating Officer with Northern Ontario School of Medicine, and I'm really impressed with the team I've been working on, and I really want to thank Dr. Sarita Verma for her leadership through these very unpredictable times. We have issued 3 communiques so far out of Human Resources to all staff and full-time faculty, and this is since last Wednesday. And we apologize for the ever-changing messaging, but we're just trying to stay ahead of the messaging as it changes rapidly from day to day. Measures to date are we are encouraging all employees to work from home if possible. Our buildings will remain open to the public, but we expect that there will be very limited activity. If an employee does have if an employee does not have a laptop to work from home, our IT unit has uploaded VPN and security software onto about 50 laptops. These are available through our IT help desk. To help flatten the curve, we are strongly encouraging staff to avoid travel locally, nationally, and internationally. We're requiring all employees who are returning to Canada from another country until further notice to work from home to self-quarantine for 14 days. We're asking you to be vigilant, monitor for symptoms, minimize close contact with others, and practice social distancing. If anytime you become symptomatic, develop a fever, cough, difficulty breathing, you're advised to follow Public Health Ontario best practices. Regarding events, and this has been across all of our communiques as recommended by public health experts, going forward, all events, meetings should be either canceled, postponed, conducted in virtual form. Given the facts we have right now, NOSM intends to remain open. We are maintaining facilities. Even with fewer of us on campus, business continuity means that your pay and benefits will continue uninterrupted. If need be, we've established payroll systems that could be monitored from our payroll officer's home. Further details and resources will continue to be posted in the coming days to NOSM's website. And finally, NOSM's Employee Assistance Program is available to those who require support. And again, Sarita, I want to thank everyone for their extraordinary efforts and leadership as we navigate through these very turbulent and disruptive times. Thank you.
Thank you, Ray. And for our faculty in all three divisions, human, medical, clinical, we know that many of our clinical faculty are already overwhelmed with clinical duties, and so we're trying very hard not to do too much to their workload. In fact, basically, we're working closely with Janice Willett and with the division heads, as well as with Sarah Newberry for contact with our rural faculty, to ensure through our CPD office and Dr. James Gertson that there is some professional development available and some support for resources for managing COVID-19. Most clinical faculty, including myself, are receiving multiple emails a day from OMA, CMA, CPSOs, CCFP, I mean, all kinds of places telling us what to do about managing the disease. And I think NOSM has stepped up brilliantly to be able to actually help clinical faculty. For other faculty, if you need to move to online or provide your resources or come up with alternate sources, IT and the programs themselves are very supportive. We'll certainly do our best to make sure that there is support for you, and of course ensure that you are also well supported. For research, generally the disruption is minimal, but we're aware that there may be perishable research being done that needs to be monitored. And of course, for library services, we're continuing to maintain business and aware that our librarians will be taxed tremendously for resources. So we are ensuring that there's support for them as well. I'd like to move over to Jay. I know you're on the phone. I think you're on mute. So if you can unmute. Jay Mashru is the president of our Medical Student Society. And I just wanted to hear if, Jay, if you had any comments or concerns from MD students are our biggest constituency, which is why I'm asking Jay to just say a few words. Are you there, Jay?
Yep. Can you hear me?
Yes, thank you.
Great. Yeah, thanks, Dr. Verma. So as she introduced me, I'm Jay, the NOSM SC president. I know it's a very stressful time for everyone, and I can't really speak to all the changes that are going on, and obviously there's much more educated people on the line that have been helping you with that, but there's lots of uncertainty, and I know it's very difficult. We're all, especially for the medical students on the line, we're all students, and we're all kind of having lots of cancellations and lots of changes that we weren't expecting to having. I just want to speak to the fact that I'm pretty proud of all the NOSM students and faculty so far. Everybody's put in extra work. People have having to leave communities, those sort of things. So a lot of people are having to do more than they were expected to do. And the communication so far between students and from the faculty to the students is the best that it's ever been. So that's great. I feel like we can have no complaints in that department. Just to speak to some of the things that we're all facing. All the presidents from the Canadian medical schools are meeting to discuss all these issues because we're not the only schools that are going through these issues. We're slowly coming to agreements on things that are going on between the different schools and seeing if we can release a joint statement for all the UMEs across the country. I know that that's a difficult thing because some schools are dealing with it in different ways. So that's something that we're slowly getting to, and we are trying to advocate for all of us. There's also some small initiatives that has been going on at some of the schools. I actually got one of them from an email from Dr. Verma, and the two first schools that started it were at Western and Toronto. And it was basically just to increase medical students' sense of commitment and being in this difficult time. I know that a lot of us, we really wish to help out, and it's really difficult to go from, a clinical scenario for our clerks and our phase 3 students to, sitting at home and kind of not really knowing what to do. So what some of the students at Western Toronto have been doing, and you can contact me if you have any more questions about this, but I sent out an email to all our NOSM students. If any student was in a community and wanted to offer any help with services for healthcare professionals that are working overtime or have children at home during this busy time, they could request a student that has volunteered to help them with whatever tasks they have. Each student would only be with one family or healthcare professional just to limit contact, but basically, in essence, just to help with things like childcare, pet care, errands, those sort of things, especially with people that have parents. So that's something that we're going to start. I'm sending out an email to liaisons and physicians in the 3 largest communities that we have this week, just so that we can organize that this week. So thank you, Dr. Verma, for bringing that to my attention. This isn't necessarily affiliated with a medical school, but we all just thought it was a good initiative for students to have a sense of being whilst also helping out as well. Also, the NOSM Student Council is going to have a meeting this week. We're still trying to figure out when that is. It'll probably be midweek. Just for students to start bringing up their concerns with their year reps. You can go ahead and do that, and then your year reps can bring that to the meeting later this week. We'll discuss what we can do to help out our fellow peers over the next few weeks. Obviously, everybody's dealing with this in very different ways, so we just want to be there to support. And my last thing, I know that everybody has a lot of concerns and there's a lot of things going on, but the medical school isn't not thinking about them. Obviously, as Dr. Ross and Dr. Verma have both said, this is something that they are thinking about. We're having to do this one thing at a time. So answers will come. This isn't something that, people are ignoring, and I'll make sure that I bug people to get those answers when I can, because I'm not forgetting about your issues. I'm going through those same issues. We're all going to have answers. We're just going to do one thing at a time once we have more information. So I just want everybody to hang in there. We're all going to be okay, and we'll have more communication as we go forward.
Thank you, Jay. And my favorite part of my day is being bugged by Jay. I just, I'm here because we have learners, undergrad and postgrad and health sciences. And, it's the best part of the job. I'll be interested to know if you're asked to go on any runs to the LCBO or the cannabis store. But just remember, you need your age of majority card to do that. No, I'm just kidding. But just thank you so much for that initiative. It's a wonderful, socially accountable work that's being done by our students and by our staff and our faculty. I see heart-wrenching, but also positive stories every day, every moment. There's admiration and respect for so many people who are stepping up. I myself have wonderful people, my EAs and staff, who've said, you're not able to get out, so can we go get you things and do things for you? And it just is so heartwarming. So thank you so much. In that regard, I'm sure you haven't heard this before, Johnny, but here's Johnny. You can introduce yourself, John.
Hi, thanks, Rita. So I guess the main point that I want to get across to all of our learners is to know that we're thinking about you and that we're here for you. The priorities right now are going to be service to our patients and taking care of ourselves. We know that the training and exams have been disrupted, but we'll figure that part out. You will be taken care of. If you get redeployed, your programs will try to reward some credit for that. And there are lots of learning opportunities when the normal routines get disrupted. I am certain that the Royal College and the CFPC and the CPSO are going to work on getting everybody graduated and licensed and working as quickly and safely as possible. From a wellness standpoint, there's a few essential points to know. So Any residents on the line who are requiring medical exemption from working with COVID patients should contact the wellness program. So pregnancy, cardiovascular disease, respiratory disease, immunocompromised, medical frailty, you're living with someone who falls into those above categories. We handle your personal health information confidentially. I think as it stands, the students are prohibited altogether from working with suspected COVID cases, but you may also wish to get ahead of the game and let your learner affairs program know if you're high risk yourselves. Residents need to know that they can refuse unsafe work, including when there's no access to personal protective equipment. Don't try to be a hero and come to work sick. Those days are over, hopefully forever. And don't jump into a clinical setting without the proper personal protective equipment or the knowledge of how to use it. There are going to be some changes in work patterns that could include things like rescheduling vacations or adjustments to call limits or refocusing on the essential clinical activities. I think, for example, elective surgeries are likely to be canceled province-wide. As this is unfolding, know that your well-being is the highest level of consideration along with patient care and public safety. If there are residents out there who are suffering from some COVID anxiety, you can talk to me or our coordinator, Jamie. You also have ongoing access to Caroline Charette, who is our clinical psychologist, and your EFAP as well. There are wellness resources specific for the students, and Dr. Shack and Learner Affairs can tell you about those. If you yourself feel that you need COVID testing, just keep an eye on what your local health unit strategy is for that. I believe centralized testing centers are being set up in the larger communities. Lastly, I've always stood in admiration of students and residents, more so with each passing minute, including Jay, who we just heard from. I'm very glad to hear you're continuing the time-honored tradition of harassing the dean directly. But no matter where we fall on the spectrum of outcomes, we're going to need some positivity in our lives. The medical community steps up when the chips are down, and I already see colleagues stepping up and showing leadership and going way above and beyond. So please, everyone, send in your positive observations. You can send them to me for now, and we're going to come up with a way to solicit them from you and from the broader NOSM community, learners, faculty, staff. We need to hear about these positive observations and statements and stories to keep us motivated while we're overworked or we're isolated or we're worried for our patients or ourselves or our loved ones. So let's keep that motivation and positive energy going.
Thanks, Johnny. That was great. And as he said, each program does have, support. Dr. Shack and undergrad, as well as Learner Affairs for undergrad and all our health sciences programs. For staff, please know that the EAP through HR and, of course, your own primary care providers are available to you. But as I said earlier, be careful not to tax I speak as a family doctor, when they're really busy, don't tax the system too much. It's already hard enough to get through to cancel appointments. And of course, faculty, same applies. We're certainly, looking for ways to support you in EAP or your own healthcare support system. That actually pretty well wraps up what we wanted to say today. I know that people probably have a gazillion questions, and so, as I said, direct them general queries to, of course, communications@nosm.ca, also dean@nosm.ca, and of course, for program-specific questions, many of the questions I received in advance is somewhat individual, unique considerations. For example, for people who need accommodation, for people who may have already been on a modified program, for people who have unique healthcare issues, and of course, for people who have unique family issues. I think you probably need to direct those to, for phase 1, phase 2, phase 3, Learner Affairs, resident program directors, and or to your resident wellness office. Please, everybody at NOSM is available to you and has some form of redundancy built in to the system. We have staff and senior leadership backing each other up. For example, I can't physically be on the campuses, but on the East Campus, Dr. Chervin and Mr. Hunt will be doing daily surveillance of the sites and will be on site. On the West Campus, it will be Dr. McCready and Dr. Gertson who will be filling in for us to be on site. So just to be aware that we do have plans. I anticipate, given this again, that by, sometime in the summer, we'll be planning a thank you and proud of NOSM party. So stay tuned. But in the meantime, we will have another web briefing like this if needed sometime in the next couple of weeks. I hope it's helpful. Please send us again your feedback on the website. If it's not perfect, let us know because we want to get it better. Please send me feedback on this session. This is the first time I've ever had over 375 people on a WebEx. I have to say that I have to suppress the need to start singing songs from Evita. But really seriously, we really want you to know that we're doing our best. So if we can improve these mechanisms of communication, please let us know. Signing off now. Good morning, NOSM. Have a great day. Stay safe, stay strong, and keep up the great work. Thank you very much, everybody. Signing off now.